Hi, everybody. Welcome. Thank you so much for joining us tonight. We appreciate you taking some time out of your evening. We're excited to have you here. For those of you who don't know me, I'm Kristen with Aspen Dental. I am an academic and industry relations manager. So I pretty much work with, the specialty residency programs, primarily oral surgeons and endodontists. So prior to COVID, we were able to travel and get to meet everybody. And obviously, that's changed drastically. So we now have this new virtual world, as we like to say. So that brings us to tonight, where we have this, awesome AMA session, which allows us to kind of all connect together, which is nice and gives you guys the opportunity to still continue to ask any questions that you have. So throughout this hour, we encourage you guys to ask, whatever questions you have at the bottom of your screen. You'll see there's a Q&A box. So please type in anything that comes to mind. If there's different topics throughout the hour that you want more insight on, please feel free to chat that in. I also have another monitor to the right. So if you see me glancing over there, there are just some other questions that were sent in when you guys registered. So I'm not trying to be rude or not pay attention, but I just want to make sure I get those as well and address them as well. So with that being said, I guess we can get started. I'm going to have Melissa introduce herself, and then we have Dr. Brown. We'll have you introduce yourself, and then we'll take it from there.
Chris, that was great. So my name's Melissa. Kristen and I work together on the academic team. I have been with Aspen since November, so pretty new, but I've been working with the specialty team similar to Kristen. Pre-COVID, I was able to visit a lot of residency programs and do dinners and lunches and fun things with you guys. Unfortunately, we're not able to do that right now, but what I do like about doing these Ask Me Anything type sessions is that we get to have, people like Dr. Brown with us to answer these questions, because I think I can tell you all the great things about working for Aspen as an oral surgeon all day long, but at the end of the day, I'm not an oral surgeon for Aspen, so it's really nice that we get the opportunity to kind of do this, and we appreciate Dr. Brown being with us. So go ahead, Dr. Brown, introduce yourself and give us a little background.
Hi, good night, guys. So as Melissa said, and Kristen, I am an oral surgeon with Aspen. I have been with Aspen since 2013. I did a combination deal. I'm also with Indiana University. I was a program director. So I'm actually part-time at the school, and I'm part-time with Aspen, and that has many benefits. I'll go into that shortly, but let's give you guys some other background. So I'm from Jamaica, obviously. You can hear my accent. I went to Howard in DC, and then I did my residency in University of Florida, Jacksonville. And then I came up to IU in Indiana. I joined Aspen. I came up to Indiana in 2011. I joined Aspen in 2013. And I've been with them since. So I've always been part-time. But the beauty of Aspen is that you do have, obviously, choices. For me, it has benefited me where I do trauma. I like to do gunshots, the stuff that I did in residency, but obviously, you guys know that does not pay. So the compensation for that is just goodwill. But the teeth and titanium part is what Aspen allows me to do. So I cover about 8 offices, and every situation, every state that you cover is different. It depends on what the need is. Aspen has been good to me, and I can say that wholeheartedly because I've brought on maybe 6 people in the last 7 years. I've brought on friends to Aspen, and I've brought on, obviously, residents that I've taught. And for the most part, most are still with Aspen. Some of them have gone into a private practice deal on the side, but for some reason, everybody still has a leg or a finger with Aspen. So it has been beneficial. I won't talk too much. I can tell you some more about my day-to-day setup, but I did see if you guys want me to talk more, or you want me to
Yeah,
go
I'm
into
gonna
the
get to, no, thank you. I appreciate that. Yeah, we have questions that are already coming in, so we can get to those, and then you can keep elaborating, however you would like. But getting started here, the first one that just came in is, what's a typical day like in terms of your schedule? Do you get to choose when to start and end the day?
Okay. Absolutely. So I will tell you one of the biggest misconception, or the biggest fears that is put forth, is that if you work for corporate, you have to do what they say. Everything is on their terms, how they want it, when they want it, and you are just like a puppet.
Right.
You, I will tell you that obviously there are different personalities. I work for offices that are, you guys, there are a lot. Aspen has a lot of acronyms for different things.
Yes.
So um, there are offices. I'll try not to use them, but uh, Aspen has offices that the doctor owns, and there are offices where a doctor is pretty much just an employee. And
Right.
obviously the offices are run differently. But um, you the first day I went there, um, I had a meeting. I had a meeting with all the office managers, all the doctors that I'll be working with. And pretty much I had a PowerPoint presentation, which is what I gave to all of my the people who I brought on, and kind of set your guidelines. This is how I want. This is the type of patient I want to see. If I'm seeing this type of patient, I need this type of medical release. Um, I need this amount of time for this amount of procedure. I don't want to be booked, etc. So some days I'll start at 7, some days I start at 8, some days I start at 10.
Right.
Some days I work until 7, some days I work until 8. It all depends on you, and I guess the obligation or the commitment that you are making once you start Aspen is that you're going to serve the office. So if the office has a need,
Mhm.
um, I guess the right thing would be, I can't come to work at 10 and leave at 4 if there's 10 patients to be seen,
Right.
or if you were in a particular office and it's pretty busy. So for example, personally, I have offices that are extremely busy, and for
Mhm.
those offices I give them more than one day. I may
Right.
go there twice a month, 3 times a month, to take the load. And there are some offices that are not so busy that a half day is more appropriate for
Mhm.
that office. So to answer your question, it can be busy. I had 2 younger guys shadow me that just started Aspen. They got delayed because of COVID, so they're just starting now. They graduated in June, so I had them shadow me a couple of days, and it's pretty much exactly what you would expect. The typical wisdom teeth, the typical exposure and bonds,
Mhm.
full mouth extractions, implants,
Mhm.
uh, and that's again your comfort level.
Right.
You'll meet with the doctor. I also work at Clear Choice, which is a implant center. So at Clear Choice, that's obviously specialized in full
Mhm.
mouth rehab, all on fours. So I have had exposure to that with zygomatic implants. So I've brought some of that into the Aspen world.
Right.
And for my benefit, or for the office's benefit, and for the benefit of the patients, I will say, hey, if you want to do this type of procedure, you need to go and do the courses. I'm not comfortable doing an all-on-4 with you, or doing a high-level implant case if you don't have the training. And for the most part, the dentists who have decided that that's what they want to do, they have done
Right.
it.
Right. And
So,
question two, do you see pediatric patients ever?
not really. So
Mhm. Yeah.
let me be honest. So I am PALS certified. Um, one of the uh, so Indiana obviously is a pretty big state.
Mhm.
I covered Northwest and the northeast side, and I am the only oral surgeon. And this is just my particular market. I'm the only oral surgeon who takes insurance.
Okay.
This
Right.
that's not common.
Yeah.
So the oral surgeons that are up there, they're all fee for service, so they're very expensive. So
Right.
I get a lot of pediatric patients. Now, I will tell the dentist, look, I am not going to hold down anybody's child. I am not going to papoose. I am not going to strangle, or I can't do that. That's not how I will be doing it. If the child, the youngest that I've seen is about 8, so technically
Okay.
almost pediatric. If the child can sit down and tolerate an IV, yes, they may shed a tear, or they may
Right.
show some anxiety. But if there is no kicking and screaming, and the parents holding the child down, then I can do it. So
Right.
the answer is yes, and it's case by case.
Right.
And usually, the office manager will reach out to me and say, "Hey, I have this kid with retained teeth, with some primary molars that need to come out. I spoke with the mom. They're okay with the IV. Are you okay doing this?" And I would say, yes, I commit to it. The morning before, we do speak about it again. And I would say 9 times out of 10, it goes smooth.
Right.
The office manager already knows that particular patient who's going to already crying, screaming. That patient needs to be treated in a different environment, not at
Right.
Aspen, or not with me, I should say.
Right. Exactly. But it's nice that you get to, to do that. Now, in terms of equipment, one came in that, what equipment does Aspen provide for you?
So I know that over the years, things have changed. Things have gotten better for the younger guys who are starting. So Aspen provided everything, whether there's a startup type of deal where you're provided with, how many sets, how many hand pieces. There are situations where you have to buy certain things, but it's not anything that you can't, at the expense that you can't afford. Right off the bat is either, for instance, I don't know if I'm misspeaking, but like for DA number, if you're an Aspen dentist and you are, sorry, oral surgeon, and you are covering 15 offices, and the DEA now for DA license $783 for one DA. If you are just out of school, you cannot pay 20 times. So
Right.
what I've heard that Aspen has done is that they will pay for that all up front, and then they will, month by month, if you're doing well, they'll take it out of your production. So back to the original question, yes, they do provide the equipment. They want you to be successful,
Right.
So, and if you don't have monitors, you don't have drills, you don't have hand pieces, that's not going to benefit them. So they are going to it's a well-run organization in terms of they want you to succeed. So
Right. So
they're going to,
essentially you feel like you have what you need, you would say, correct? Like any supply that you need for the greater part, you have access to
correct.
at least. Right.
Correct.
Perfect. Good. And then what about, do you have use of a CBCT?
Yes. So again, because of Aspen has some new, this is a new mandate where they're trying to get every office to have a CBCT.
Exactly.
COVID kind of slowed down that for a number of offices, but I would say every office that you go to has an Aspen Dental that's nearby, where the patient does have access to a CBCT. So
Right.
if you want one, you can actually get it. That's not an issue.
Right. Yeah. And for those two also, I know like all our new practices are being set up and equipped with them. And then by the end of next year, we're hoping to have all of them. So that's good. For the most part, what do you travel with?
Everything.
Whatever you can fit in there.
So Um, for I know that, so I have obviously a number of colleagues that do this. I know I have some that their assistant carries the stuff.
Mhm.
Um, I have some that they break it up between the assistant and the oral surgeon. Personally, this is how I've done it. It's not, I don't know if it's the correct way, but I carry all my stuff.
Okay.
So I have a SUV. I have everything that I need. It's like a walk-in office. I have my monitor, my everything, my equipment.
Mhm.
But I know some people go to the same offices over and over and over. So for some
Right.
people, they're able to leave some of their stuff there, so they don't have to travel with it all the time.
Right. Okay. And then another one came in. Are you able to access patient records when you're not in the office, being that you're at different locations if need be?
Yeah. So there's the app that you can log on to on your phone.
Mhm.
There is remote login where the electronic medical record is actually obviously it's an electronic medical record, so it's available everywhere. So
Mhm.
when I started Aspen, that was not, it was paper charts, but
Mhm.
it's gone over to electronic. So everything,
Yeah.
you can be in one office and you can see, you can pull somebody's chart.
Right. Okay. The new digital world, right? Everything's paperless nowadays. How about going back to like equipment and stuff like that and supplies? How is sterilization handled, being that you're traveling with your instruments and equipment?
So I have a main assistant that is in charge, and uh, I suggest that you'll do the same. That you have one person who is making sure that all of your equipment is sterilized, when you leave the office. Um, and they're all, I have bins that, like, literally like trolleys that I pull. So all of my equipment is kept in there.
Mhm. And then do you get to work with the same dental assistant to every office? And do you get to have say in that?
Yes, you do, and that is again up to you. I would say that, if these are all residents on,
Mhm.
it is very critical that you have the same team, that
Right.
everybody on the same page in case of an emergency. They all know where everything is. They all know how to deal with certain things. So yes, your assistants are yours, and that's if you
Mhm.
want. My assistants actually, one assistant works with me at Clear Choice, and the
Mhm.
other assistant works for Aspen full time. So when she's not with me, she's working in an Aspen dental practice. So she's always available.
Right. It's nice to kind of have the same system, you get to take to each location. Um, where do you get your referrals from?
So again, one of the benefits that Aspen provides is that you don't have to get referrals. The office is the referral. There's no wine and dining. There is no going out and sending letters and asking for competing. You have a schedule built for you.
Mhm.
So that's having referrals is never an issue. No, I mentioned earlier that I'm in a region that it's fee for service. So I get a lot of other people's referrals, a lot. They'll come in, their dentist will send them a referral. They'll go to that particular private practice. The private practice doesn't take insurance. They go
Mhm.
online, they say that I'm in network, and I get all
Mhm.
those referrals. So, but I mean, technically, you don't need them. All it does is it generates more business. The benefit of Aspen is that the office is your referral base.
Right, right, exactly. And then we just had another one come in that says, what percentage of your patients are Medicaid versus insurance versus out of pocket?
So there's no Medicaid.
Right.
Um, we don't see Medicaid patients. Um, I would say it depends on, and I would say it would be it would location by location. In one location where the patients are more affluent or working class, I would have, in this particular office, I'd have more fee for service. And then in some other regions, for instance, one of the locations I cover, I see a lot of factory workers. So in that location, Indiana has a very big RV industry, steel. So I see a lot of the workers for wisdom teeth and the children. So all those people have insurance. In this other region, I may have just straight fee for service.
Right. Right.
Obviously, that's what you prefer.
Right.
But
Exactly. Yes. Not always the case, but would be nice, right? Who sets your fees?
so Aspen, one of the things that Aspen has, and I'm pretty sure this is not unique to Aspen. They do what every oral surgeon, every endodontist does. There is what is the set fees that that is set by the state. What is it for a wisdom teeth should cost, and Aspen is usually on the higher side. So they're never undercutting the fees. So there are set market fees that this is how much this should cost versus this. Aspen will never go, it's never lower. One of the benefits, to answer your question for the fees, is that Aspen works with the insurance companies. So I can tell you from personal experience, when I just started in one particular location, the insurance company was cutting our wisdom teeth full bone impacted. And Aspen was able to generate, the insurance department was able to generate and say, look, we see a lot of your patients. And if we are going to continue to be network with you guys, then you're going to have to give us a better pay rate. And
Right.
that's one of the beauties of working with Aspen, that they do have clout. If you have 800 plus offices,
Right.
you can bargain with Delta Dental, Blue Cross Blue Shield. You have that force to say, hey, we are sending a lot of patients. We are seeing a lot of your patients. You have to work with us to make it fair.
Right. Fair enough. Yeah. Gives you more power, right? Going back to this too, what kind of support do you feel like Aspen provides to you to focus on your patients?
So as I tell you guys, this is not hypothetical, because I am in private practice and I am with Aspen. So I see both sides of the coin. Aspen is focused. Their focus, obviously, it's a company, it's a business. If you are not doing well, they're not doing well. So in terms of hiring, HR issues, providing what you need, the support, it doesn't matter. It doesn't matter what you need. They have everything. They have, for instance, they have a legal department. I have had friends who have gone through lawsuits or attempted lawsuits, and Aspen is there right behind them, right behind you as a practitioner. So you want to know that you're working for somebody who obviously has your best interest, and
Right.
you not working and you not being your very best, and them not putting you in a situation to do your very best is not really helping them either. So the support is unbelievable.
Yeah, no, that's good to hear. And I hear that from other docs too. It's nice that a lot of them tell me too, they love the part that, Aspen helps support them on the entire business side of it. And then you guys get to just do what you love to do best, which is the clinical side. You don't have to worry about, oh, we don't have the supplies we don't need, or, some equipment broke down, right? You don't have to worry about it. You get to just do what you love to do best, and then treat the patients. Would you agree?
True. Agreed. And
Yeah.
that is I would say for most people, that's the the main reason why you join Aspen. So you don't have to do the business side. You don't have to worry about, setting insurance, filing claims. You have somebody doing all that stuff for you.
Right.
So you can focus on just coming to the office and getting the work done.
Yeah, no, that's awesome. Also, how many operatories do or can you work out of?
Again, depends on the office. I usually have two, but I've been in offices where they've given me 3 up to 4. Now I'm only one person. There's no need for me to have 4 operatives. Maybe I see a consult, a post-op, a local, and then I have a sedation. But that's pretty hectic. But again, wherever you're going, the dentist in the office is trying to support you. It doesn't make sense that they're hogging the rooms or making it difficult for you to work if they are providing the patients, they need you to see patients. So I've never been at the office, never in 7+ years.
Mm,
I've never been at the office where I have had an issue with getting an opportunity to use.
okay.
Sometimes I even use more than I'm supposed to. Yeah.
Right. Right. And then going back to that, what would you say you were just kind of, if you could elaborate it more, like a typical day, a typical schedule for you in terms of, how many patients you're seeing, et cetera?
Um, I'm crazy. So if you guys see my schedule, and this is totally by choice. I have a very busy schedule. Aspen for me, it involves traveling. So if I'm going to sleep in a hotel, I'm going to be 100% transparent. If I'm going to drive and sleep in a hotel, it doesn't make sense for me to leave the office at 5 and go and sleep in the hotel for the rest of the night until the next morning. So for me personally, I'm going to get everything that I can get. So if they schedule me until 8 or 9, I'm going to work on that. No, that's not everybody, and I don't recommend that anybody joining do that. But that's just me personally, and that was my choice. I have long work days, but when I just started, I'd probably see
Mhm.
8 people for the day, eight,
Right.
7 to 8 people. That was manageable. But as you know, you build up confidence, you build up speed, you know what you can do safely. And I added more patience.
Hmm. Okay. Fair enough. And also, since you're going to multiple offices, how do you handle potential post-op, if there's any complications?
So one of the things that I mentioned earlier of having that initial meeting with the docs of your expectations. So just like if you had your own private practice, that's how I treat Aspen. So if a patient calls and say, "Hey, this doesn't feel right. Um, I think I'm having an issue." 9 times out of 10, I don't try to solve it on the phone. I say,
Mhm.
"Hey, why don't you go back into the office and have the doctor see you?" No, I'm in the region someplace, and I'll tell the patients, you may not you may not be able to see me at the same office that had the procedure done. It may be a half an hour away. And if you need to see me, then I'm available to see you. So if you are willing to make that drive to see me for 30 minutes, that's
Mhm.
cool. That usually never happens because the dentists that I work with are fairly competent. So the patient will go in and they're like, "Oh, hey man, it's just swelling, or it's sutures, or that's normal, or don't
Right.
worry about it." And then I would tell the dentist that, "Hey, you reach back out to me and say if you have any concerns, you let me know, and we can take it from there. We'll have to see the patient." To add to that, Kristen, personally, on my post-op, again, I know everybody doesn't do this. I have a Google number, like a Google cell phone number.
Okay.
Every night, I call every single patient that I see.
Very
Um,
nice.
I call every single patient. I've been doing this ever since I graduated. I call every single patient, if it's 10, 12, 15. So
Yeah.
every patient has my cell phone number, my Google number. So technically, if I want to turn it off, I can. I never do, but I
Right.
can turn it off. So
Right.
I call the patient, I leave a message. If they don't answer, I leave a message. Majority of them will answer or text me back. And I say, "Hey, just as I said, if you guys have any issues, any problems, please reach out to me and ask me. And a bunch of them will just text me and say, hey, thanks for calling, got your message. Or a week later, they'll say, hey, my sutures came out. And I'll be like, yes, that's okay.
It's going to be okay.
Yeah, it's such,
Wonderful. Thank you. That was our next question. What was going to be your, how your follow-up is, but you just addressed that. So thank you. What's the typical collection percentage with Aspen, which is the next question that came in?
So I'm one of the old dogs. So I'm on a different, they're different. They made it fair for you, for the new people, but I can tell you right off the bat, and this is because I think I see Seth is on. He can probably type and say this, but I will tell you that there are not many places that you'll get compensation like Aspen. There is not many. I have one of the things that Aspen will spoil you in that you graduate from residency, you start Aspen, and you're making 4 times as much as if you became an associate. So the compensation is and that is why I said I have friends that they never leave. They may step back for a bit, but there is no, especially for someone fresh out of school,
Yeah.
student loans.
Yes.
You don't know what you really want to do, where you want to live.
Right.
You know, it gives you a chance or an opportunity to explore, and there's actually no disadvantage, as in you'll be able to, if you're trying to, I don't know if this is the right thing to say, if you're trying to open your own private practice, this is a great way, because of the extensive compensation, to build that reserve to pay off your student loans. But I will tell you guys, everybody who comes in with that idea, the money is, the compensation is so great. You're like, maybe next year, maybe next year I'll leave.
Yeah. Hey, I get it, right? It's hard to leave that once you get that. Now going back to like scheduling too, like how far in advance do you build out your schedule?
So once you get going, and if it's a established Aspen practice that you are joining, for instance, I am starting a brand new Aspen practice, not brand new. I'm starting a new office for myself. It's already been open. Another oral surgeon used to cover, and that oral surgeon moved to California. So Aspen reached out to me and asked me if I wanted to cover the office. So this is I am going there. It's a new location. I start on Tuesday. This is my first day going there, and I have $35,000 on the schedule. So,
wow. That's
so
impressive.
I have not done anything. All I've sent them is my guidelines, how I want to schedule patients, what I need to do, what I need to do, and voila, I have 35 grand on my schedule on Tuesday. No,
I would say that's a good day, huh? It doesn't get any better.
that's a very good day.
Yeah.
When I started, I used to think that 15,000 was a good day.
Yeah.
So
Yeah.
so it is definitely a typical day can range anywhere from $10,000 to $50,000
Right.
in terms of production.
Right. No, that's amazing. That's awesome. And what about in terms of procedures and stuff? Are you also doing all your own consults and so forth?
So once you start, I do, if it's a straightforward set of wishes, third molars, then that's something that the experienced general dentist can do. I mean, they pretty much can set you up to do that. No, if it's a more complex case, whether it's pathology, whether it's an implant case where your involvement is definitely needed, then I'll do my own consults for that.
Mm-hmm. Okay.
But typically the dentist does most of it.
Right.
But Doc, you can kind of set your own rules as far as that goes, right?
Correct. So I was going to say this. So this is what I have done, and I know a lot of people don't, and it's how you want to do it. Because this is the first time I am meeting these patients. Every patient that I see at Aspen, I spend about 5 to 10, well, on average, about 10 minutes with them in the consultation room at the office. That's personally for me. And for instance, this new office that I'm going to on Tuesday, they're like, why are you doing that? And I will say, personally, I have never met this patient before. I'm trying to establish a relationship with the patient. This is an opportunity for me to build rapport and to show that, hey, I'm not just interested in the money. I really want this to go well. So every patient that I personally see, I have a pre-consultation with them before I take them back. And I go over consents, I go over all that stuff.
I think that's huge, especially like, with oral surgery, because, these patients are nervous. I would imagine that goes a very, very long way. I know it would with me.
I think personally, and every office that I've done it with, initially they used to say, hey, you're spending 10 minutes extra with every patient. Isn't that you're cutting down on your production? And I would say to them, like, personally, I want this to go well. And I want to know that the patient knows that I care. So that extra 10 minutes to me is invaluable. And I think that it helps me on my reviews, and it helps me, because the residents know not every single case is going to go perfect and amazing. You're going to have some hiccups. And when I do, a lot of times I will say, remember, Melissa, we did speak before, and I did tell you that you may have some numbness in your tongue and your lip, and it may last for a certain amount of time. And they go, oh yeah, you did say that, we did talk about that. Okay, that makes sense now. Okay, I'm a little bit more relieved because you did tell me before.
Right. And that goes a long way, making them obviously feel comfort. So what about now that we're in this whole COVID pandemic? How do you think, how have you seen, in terms of supplies, have you been able to have everything that you feel like you need in order to be safe with COVID?
Yeah, excellent question. So so I work for Clear Choice, I work for Aspen, and I work for the university in Indy. So one of the things of Aspen is that Aspen has buying power, right? That a lot of private practices don't have. I have never, when N95 masks were short, I had Aspen sending me N95 masks to my house, my home address. They were sending supplies, PPE. So I have never been without. No, when I was at university, at some point the hospitals got really tight on what you could have and how much you could use.
Mm-hmm.
At Aspen, I have a box of N95 delivered to me every month. My assistants, everybody, we have always been in excess. So
That's great.
my supplies have never dwindled. The
Yeah,
patients
that's
have.
great. Yeah. Well, that's going to happen a little bit, right?
Yes, at one point that did happen, but that happened everywhere because we couldn't do
Right.
elective spaces. But
And that was specific to region as well. I think some regions didn't feel that as much as others.
Sure.
And then there are a few oral surgeons and endos too that I've done AMAs with recently that actually said that they were busier because every other practice around them was closed and they were still open for emergencies. So they just by default got every patient from the whole entire area that came to them for emergency cases.
True. So in terms of the emergency patients, I was talking in terms of the elective implant cases. Oh yes, Aspen was one of the only places that remained open,
Yep.
for patients during COVID. So yeah.
Which we got a lot of feedback from patients about that and how much that kind of meant to them to have a place to go if they had that emergency. So
yeah, for sure. I know, like Melissa, you said there are certain geographical areas that were obviously affected, more than others. but I'm glad that, you felt that way. Also, what about in terms of medical insurance? Can you explain a little bit, the benefits and so forth that, you receive working with Aspen?
So just like any major corporation, you get full benefits. You're a part of a major insurance carrier. So Blue Cross, Blue Shield, Anthem, whichever one Aspen is doing the coverage with. So everything I'm married, I have, 3 kids. So definitely when the Aspen plan versus at one point I had the choice of being on Aspen and being on IU's plan, and Aspen insurance plan was better than the IU plan.
Well, that's good to hear.
She had more access to doctors. The doctors that she wanted to see. The children could go anywhere that they needed to go. So the plan is actually very good.
And to like reiterate, Dr. Brown is part-time. And so Aspen, if you're working at least 4 days per month or more, as a specialist, you're eligible for medical benefits, even as a part-timer, which is really nice because, a lot of companies don't give benefits for part-time. You have to be full-time. So, just wanted to point that out. If you're full-time, you get an even better benefits package. But at least you get the medical insurance if you're part-time.
Exactly. Okay, next question. Do you personally introduce emergency protocols to each location you are assigned to?
Yes. So as I said earlier, I travel with all my equipment. I have emergency drills with my staff. I have a emergency cart. That's just, ambu bag, cry kit, laryngeal blade, everything that in the event of an emergency. Now, when you just start Aspen provides you with all that stuff, and that's a part of the startup package, blades, emergency equipment, all that. Now, depends on the state that you are in. In Indiana, unfortunately, they don't require you to have every office to have an AED. No, initially when I started Aspen, that was the case. So I used to bring I still do, my AED, but no, Aspen has an AED in every office. So they have an AED, I have my own AED. So there is a protocol, but ultimately, as you guys all know, these are dentists. If you're an oral surgeon, you're sedating, the responsibility is on you and on your staff, or ultimately on you. So you're in charge of it.
Right. And then next, does Aspen require that you use a specific implant system, or is it up to the surgeon?
So I don't believe that they force you to use a specific implant system, but I can't share the cost of the stuff that we get because it's confidential, but we pay less than a third of what the implants would cost. So if you're joining the system, we use Nova Biocare, which is one of the largest Danaher's, one of the largest implant companies. And with Clear Choice, I use Nova Biocare as well. The research on it is extensive. I didn't use it in residency, but I started with Aspen. I did multiple courses. I had the reps come in. That's all I use now. And remember, at the end of the day, guys, whoever asked that question, if Aspen is getting you a very good implant at an amazing price,
right?
Remember that you are buying the implant. So, and they have buying power. So economically, could you use another implant system? Yeah, they will. But it won't be at the same price as if you could get a Nova Biocare implant. So let me rewind. So there are certain equipment, certain bone grafts that I used in private practice that I wanted to use at Aspen. And Aspen said, hey, you can use it. That's fine. We can get it for you if that's what you want. But let's say, for instance, they say, hey, the bone graft that you want is 110. we can get it for 90, but we can give you a similar product that has the same, benefits, same advantages, same disadvantages, and we can get you that same product for $25. I mean, you're like, okay, all right, well, let me try it,
Yeah.
So, because at the end of the day, it's coming out of your compensation. And once you're not harming the patient, once it's a quality product, once it has extensive research on it, I don't think that, personally, I don't know why I would choose something else.
Yeah.
Right. Makes
But
sense.
it's nice that they give you the choice, if you wanted. And the other thing with the implants is, when I've done this with other oral surgeons, most of them will say, they'll use Nobel BioCare, let's say 90% of the time. And then if they feel that something else would be better for a certain reason, they do use that. But one of the surgeons brought up the fact that, Aspen is doing this big implant push right now. So all of the general dentists are also getting the courses on the restorations. And they're being trained on Nobel BioCare doing the restorations. That's what the general dentists are more familiar with. So it's easier and better for them. It's cheaper for you, doc, and it's better for the patient because they're going to have a better experience because on the general dentistry side, they're going to be more comfortable to restore them. So it kind of works out nicely for everybody.
Right.
True. So, and when you're in private practice, remember you're getting referrals from everywhere. So one referral may want you to use Biomed, one may want you to use Nobel BioCare, one may want you to use Strawman.
Yep.
As an oral surgeon, if you want to make that referral happy, you have to do what they're asking you to do. So you have all these implant systems. Now, if you work for Aspen and your major referral basis is a Nobel BioCare implant, is a win for you. You don't have to stock different implants. You don't have to stock anything. You just have one system that you use.
Mm-hmm. Right. Fair enough. And the next one is, what about, does Aspen cover your malpractice insurance?
So remember, as I said, I am old school, so I'm not sure. I believe that they give you, for me personally, again, I know that it's different for different people. I know that initially, when you start, they didn't have Omsnick. Let me give you some history. So Omsnick is the largest oral surgery provider for malpractice in the United States. Initially, Omsnick did not want to cover any oral surgeon who was affiliated with corporate dentistry because it was deemed, bad. However, again, because of Aspen's influence and the amount of, good oral surgeons that Aspen had and the track record that they had, Aspen and Omsnick made a connection. So Omsnick was able to insure us at a discounted rate that they would not offer other providers. So I believe there's a certain amount of time, I don't want to misspeak, but there was a time when they completely paid for it. There was a time when they paid a portion of it, and then they'll take a portion of it out of your salary. So they would pay, like for instance, if your premium was $7,000, they would pay Omsnick the $7,000, and then they would take 7,000 divided by 12, and then they would take that out of your salary. Depends on how you start. I'm not sure how it is now. They would even give you a portion of that 7,000. So they'd say, hey, we'll give you 30% of the 7,000. So you'd only be responsible for the 70%. So yeah.
Right.
So now it's up to 10,000 per year for full-time, and they prorate it for part-timers. So typically for the full-time guys, especially the ones coming out of residency, that usually covers them because they don't really have dings on their licenses yet. So some of the guys that are, been working for a little bit longer, if they do have a couple of things against them and the premium goes up, then you would just have to cover whatever the difference is. That's how they're doing it now.
Yeah, so we're getting close to the hour here. So I like to ask these two last questions, Dr. Brown. What would you say that you like? We'll start with this first, the least about working for Aspen, if there is.
Wow. Um, hmm. Okay, so in my let me be completely transparent. I never thought in a million years that I would work for Aspen. That was not, when I was in residency, corporate was looked down on. It was frowned upon to be a part of corporate. You weren't doing the right thing. You're selling out. Um, so it had this image, and I found that to be completely far from the truth. Far from the truth. So one of the negative things of initially, not now, but initially, it wasn't uh, it wasn't a proud moment, 8 years ago, 7 years ago when you say you work for Aspen, but no, it is, so it is definitely has come around to be positive. Now, that being said, I saw myself working at a hospital in a private practice in one location. That sounds perfect. That sounds ideal. I drive to the same office every day. I don't travel. So I would say the negative part is the driving. If for me to be completely honest, that would be,
Right.
I would love to be in one location and to see and to just be easy, don't have to travel. But with most of my friends who have that setup, the compensation is significantly different. So
Yeah.
it's give and take. I could be in one location and make a third of what I make, and it would be nice and chill, or I could drive. So
It's a good trade-off.
yeah, I believe.
Right?
So
Yeah.
it's not that I don't like it,
Right.
but I wish I didn't have to drive. But based on the advantages and how it has been for me personally, it's
Mhm.
definitely worth it. Definitely, 100%.
We love to hear that. I'm so happy to hear that. So on a high note, what would be the best thing about working that you like the most working for Aspen?
Um, that's that's a loaded question. One, I would say one, obviously the compensation, I'm not going to like the compensation. Two, the fact that the work they're setting me up for success. You know, I don't have to, I don't have to worry about my schedule being full. I don't have to
Mhm.
worry about referrals, you know. There is so much advantages. I don't have to worry about the business part. I don't have to worry about working with the insurance. I don't have to fight with these people to get paid. I mean, the fact that, Aspen, the malpractice part, I've never been sued, thank God. But somebody has attempted to sue me, and Aspen was there 100%, the litigation department, and they were like, "Hey, don't worry about it. Send me the records." They're very supportive. So from the compensation to the business to the litigation part, um, the support. I will tell you, even in this COVID thing, majority of my friends who have their own practices,
Mhm.
COVID hurt, even with the PPE
Yeah.
loans, because they're getting money to pay their employees, not to pay themselves. They still had rent to pay. They still had all this. At Aspen, I, I had to worry about moi. You know, there was a huge advantage during this COVID of working for Aspen. And then people will always say, "Oh, you need to be your own business. You need to have your own business. You need to, have your name on the wall." But
Mhm.
in this particular situation, having your own business during a situation like this hurt. So Aspen again has proven to be, one of the better choices that I've made.
Well, that's awesome. We're so happy to hear that. And there you go.
Probably one of the best answers to that question that we've
Yeah,
heard yet.
I would say so.
Yeah.
But thank you. Thank you so much. We're pretty much, at the hour here. So I think we've addressed all the questions. So Dr. Brown, I want to thank you so much for taking the time. You were incredible. And Melissa, thank you for joining us as well. And all the participants, thank you so much for joining us tonight. We hope you all have a great night.
All right.
Thank
Thank
you,
you, guys.
Dr. Brown.
Thank you
Thank you.
guys. Thanks again,
Bye.
Dr. Brown.